To all, I am Durga, working as a nursing lecturer in Emmanuel College of Nursing. Today we are discussing about anatomy of the axial skeleton. The skeleton consists of 206 bones, cartilage, joints, and also called articulations, are the junction between the skeletal elements and ligaments. Ligaments are the connecting bones. Then the skeleton divided into two parts, axial skeleton and appendicular skeleton. Axial skeleton, its form long axis of body. It consists of skull, vertebral columns and thoracic cage. The next one is appendicular skeleton. This is the appendage and what they attach to. It under this appendicular skeleton, upper limbs, pectoral girdle, lower limbs and pelvic girdle. Now we are discussing about axial skeleton. First one is cranium. Wallet, skull cap. It's form a superior, lateral and posterior aspects of skull and forehead. Then base of the floor is inferior part. Prominent bony ridge divided cranial bones into three fossa: anterior fossa, middle fossa and posterior fossa. Then cranial bones. There are 6 bones in cranial: frontal bone, parietal bone, occipital bone, temporal bone and sphenoid bone and ethmoid bone. The parietal bones are paired bones and the temporal bones have paired bones. Then cranial cavity houses brain. Inside the cranial cavity, the brain is inside the cranial cavity. Then smaller cavities are housing middle and inner ear, nasal cavity, orbits and sinus. Openings are otherwise called foramina or canal or fissure. Spinal cord, blood vessels, then 12 cranial nerves. Remember, the skull is composed of cranial bones or cranium and facial bones. Facial bones are form framework of face, form cavity for sense organs of sight, taste and smell, provide opening for passage of air and food, hold the teeth, anchor the muscles of the face. Then facial bones, mandible bone, vomer bone, maxilla, zygomatic, nasal, lacrimal, plantains and inferior nasal conchae. Nasal cavity of bones, nasal cavity of bones and cartilage. Roof is ethmoid cribriform plate. Floor formed by palatine process of the two maxilla and horizontal plate of palatine bones. Then paranasal sinus. It's a air-filled sac in the bone. Paranasal because they cluster around and connect to the nasal cavity. Hyoid bone. Only bone which does not articulate with any other bones. Movable base for the tongue. Points of attachment for neck muscles that rise and lower the larynx during swallowing. The vertebral column. Fetus and infants, 33 separate bones are vertebrae. Adults have 24 vertebrae. Inferior 9 have fused forming sacrum 5 and coccyx 4. Vertebrae: cervical 7, thoracic 12, lumbar 5, sacrum 5.